There is no doubt that the liver is an important organ that keeps our bodies working right. On the other hand, liver cirrhosis is one of the diseases that can be dangerous to this organ. Let's talk about what cirrhosis of the liver is and the 10 signs you should never ignore. What is cirrhosis of the liver? Liver cirrhosis is a long-term disease in which liver tissue gets scarred and damaged over extended periods of time. This scarring slowly changes healthy liver cells, which makes the liver work less well. Cirrhosis can be caused by many things, including drinking too much alcohol for a long time, having chronic viral hepatitis, fatty liver disease, autoimmune hepatitis, and some liver diseases that are passed down through families. You should pay attention to these 7 warning signs. 1. Being tired and weak. If you have liver disease, one of the first signs is feeling tired all the time. As the liver's function decreases, it makes it harder for the body to store and release energy, which makes us tired and weak. 2. Yellow skin. A common sign of liver disease is jaundice, which is when the skin and eyes turn yellow. When the liver is hurt, it has a hard time getting rid of bilirubin, a yellow pigment that is made when red blood cells break down. This causes bilirubin to build up in the body. 3. Loss of hunger and weight loss. People who have cirrhosis of the liver may lose their hunger or lose weight without meaning to. 4. If the liver is damaged, it might not make enough bile, which is needed to break down fats and receive nutrients. This could make you lose your appetite and weight. 5. Pain and swelling in the abdomen. Having ascites, which is fluid buildup in the abdomen, is a common sign of cirrhosis of the liver. Having too much fluid in the abdomen can make you feel uncomfortable, bloated, and in pain. 6. Skin that itch. Cirrhosis of the liver can make you itch a lot. Toxicants building up in the body can cause this burning feeling that spreads to many places. If you have constant itching that you can't explain, especially if there isn't any obvious skin rash or irritation, it could be a sign that your liver isn't working right. You should see a doctor about it. 7. Loss of body fat. As cirrhosis gets worse, our liver's ability to break down proteins gets worse. If you do this, you might lose muscle bulk and lose muscle wasting. For people with liver disease, even if they eat well, they may look weak. It is best to see a doctor if you notice a big drop in muscle tone or weight loss that you didn't mean to happen. 8. Poop that is black or bloody. Liver cirrhosis can lead to bleeding in the intestines, which can cause black, sticky stools or bloody vomiting. If you have dark or red stools or are vomiting blood, you should see a doctor right away. 9. Bleeding or getting bruises easily. With the help of vitamin K, our liver makes a protein that is needed for blood to clot. On top of that, the organ helps get rid of old or broken blood cells. If your liver is hurt, it doesn't make enough protein, which makes you more likely to get hurt. Having your legs, feet, or joints swell up. Less of a protein called albumin is also made, which makes the legs and arms swell. Blood doesn't leak out of blood arteries and into the tissues around them because of this protein. When there is less protein, fluids start to build up in the blood vessels. What should you do if these things happen? Get medical help and talk to your doctor. He will tell you to get a liver function test, LFT, and will treat you based on how bad the liver disease is. Also, change the way you live to help your liver get better. Here are some things you can do to keep your liver healthy. 1. To keep your liver healthy, eat well. 2. Stay at a good weight. 3. Do a lot of exercise. 4. Don't drink alcohol. 5. Give your body water. 6. Stay away from alternative medicines. 7. Don't take too many medicines. 8. Do regular tests to see how well your liver is working. Effects of having cirrhosis of the body. Cirrhosis of the liver can cause a number of possibly life-threatening problems if it is not treated by a doctor. 1. Bleeding from blood vessels that are too big, called varices, in the esophagus or stomach. 2. A buildup of fluid in the abdomen called ascites. 3. An infection of the fluid inside the abdomen, spontaneous bacterial peritonitis. 4. Liver failure. Loss of liver cells and scar tissue that blocks blood flow through the liver can make the liver less effective. 5. Brain damage from toxins that the liver hasn't been able to get rid of, hepatic encephalopathy. Hepatocellular carcinoma is the most common type of cancer that is caused by cirrhosis. Osteoporosis. Weak bones. A diagnosis of cirrhosis of the liver. To find out if someone has liver disease, tests may include 1. Health history. 2. Physical checkup. 3. Tests of the blood, such as liver function tests. 4. Tests of the urine. 5. Imaging tests, like ultrasounds, were calculated. 6. A computerized tomography, CT scan, or brain imaging. 7. MRI. Transient elastography, fibroscan TM, is a test that uses ultrasound to find cirrhosis of the liver. If you don't use specially made XL probes, this test is less accurate for people who have problems with fat. Getting liver samples for testing in the lab is called a liver biopsy. How to treat cirrhosis of the liver. Cirrhosis of the liver can't be cured, but some treatments can make it less likely that the disease will get worse. Some treatment options are 1. Getting rid of the cause of the liver damage, like getting rid of a hepatitis B or C virus infection or taking out blood to lower iron levels in people with hemochromatosis. 2. Changing what they eat and how they live. A healthy, low-fat, high-protein diet and regular exercise can help people stay healthy. 3. Staying away from alcohol. Alcohol hurts the liver and other healthy tissues. 4. Taking certain drugs, like beta blockers to lower blood pressure and lower the risk of bleeding or diuretics to get rid of extra water. 5. Not taking certain drugs that can make the effects worse, like opiates, sedatives, or non-steroidal anti-inflammatory drugs, NSAIDs. 6. Seeing a doctor regularly and getting scans to look for liver cancer. Getting endoscopic procedures on a regular basis to see if they have varicose veins in their nose, throat, or stomach. 7. Getting a liver transplant, which is a possibility that might be thought about in very bad cases. Like, share, subscribe, and comment.